So this is the reason why we really encourage everybody to think about Medicare and healthcare planning and retirement, because it's the number one bogey in people's expense management as they age. And a lot of times what we get from clients when I ask them, when we're doing their plan, I say, well, what do you have for medical insurance? A lot of them go into Medicare under the idea that, oh, I don't need any insurance. I've got Medicare. It covers everything, right? And then something happens in life and they find that that's not the case. So that's why it's important to plan and understand what Medicare does and doesn't cover. So Chris, would you give us a little idea of just the basics of Medicare? Like what is Plan A, B, C, these things that people hear about as simply as possible?
Yeah, sure. Okay. And like Colby said, this is going to be kind of a brief overview. It's not going to be comprehensive, but we have to know the basics in order to understand why we need Medicare, what options we have in Medicare, and why we would choose those options. So when we look at Medicare and what we call original Medicare, it's Part A and Part B. So Medicare Part A is your hospital insurance, as it says on your Medicare card. Mm-hmm. What I like to think of it as your inpatient insurance. Whenever you're admitted as an inpatient, whether it be the hospital, a skilled nursing facility, or even some parts of home health, Part A is what's going to cover you. So Part A is premium free for most people. So as long as you or your spouse paid their taxes for 10 years and earned a total of 40 credits with Social Security, Part A is going to be premium free for you. So meaning you won't have to pay for Part A.
Gotcha.
So whether or not you're going to join Part A or want to join Part A when you turn 65, maybe you're still working, maybe you aren't. Either way, it will be free. So it's usually always a good idea to get Part A. There's only a few situations when it's not. And if you fall into one of those situations, like having an HSA account, you can talk to somebody like me and I can walk you through that process.
Okay, perfect. So Part A, basically everybody gets, as long as you've been employed, paying into the payroll tax system for, let's say, 10 years. It's very similar to the qualifications for Social Security.
Yeah.
You have to have a certain number of quarters of earnings type of situation. And then you can also opt out, is what I hear you say, if you wanted to, but that doesn't sound like it would be necessarily a great idea.
Yeah, it's usually not a great idea. A and B are optional. A lot of people think that you have to enroll into it. Part A is completely optional. But like I said, there's very few cases where you shouldn't enroll in it. Sure. It is free. You've paid for it your whole life and earned it. You might as well enroll into it.
Might as well get it. Okay, so, and that covers anything that's inpatient. So if you're admitted into a hospital or skilled nursing, like you said, so the process of admission is basically what triggers that. So if the inpatient is Part A, what does Part B cover?
Yeah, so Part B it's on your card, it will say medical. I like to think of it as outpatient. This is going to make up, 90% of your day-to-day stuff. This is doctor visits, specialist visits, ambulance, emergency room, urgent care, even surgeries, and even being overnight at the hospital under observation is still considered outpatient. You have to be admitted to be inpatient. So Part B is going to cover all of that and actually a whole lot more. Part B does have a monthly premium. Okay. So you will be paying per month for Part B. Medicare is going to look at whatever your income was from 2 years prior to determine your premium for this year.
Got it.
So if we look at 2024, Medicare is going to go back and look at whatever you told the IRS as your modified adjusted gross income for that year. That's going to determine your premium for 2024.
Okay. So let's average that out for somebody who's like, let's say most of the people probably hearing this are in Southern California. Mm-hmm. And let's say their average earnings, let's say it was $150,000 a year, a married couple. And maybe as a married couple, it's over 200.
Yeah.
What do you think the average premium is this year for Part B for people?
Yeah. So the premium for Part B has a base rate. It's $174.70. So that's what we start at. If you get up into the next income bracket, it goes up about $70 for that income bracket. So average, like you said, in Southern California, we're a little bit higher income earners. So if you're over 200, you'll pay about $250 a month.
Okay.
Yeah.
Good. So that's some good things for people to realize, is that with Part B, that premium is income adjusted. So as you're going into retirement, if you can try and bring down your taxable income as much as possible, you might be able to save yourself on some Medicare expenses as well.
Exactly. It's usually those first few years after retirement, or maybe you're still working and you have Medicare, that you'll see those higher premiums. When we get to retirement, usually it'll come back down.
Okay, interesting. And then, you hear about Part C, or what they call Medicare Advantage, and that's where a lot of our clients get confused. They go, well, Part A and Part B, that's regular, normal Medicare. That's what I got. Well, what's this Part C, or this Medicare Advantage plan that they hear about?
Yes, when we look at Medicare A and B, it's really basic coverage. It's not meant to be comprehensive, and it never was meant to be. So before Medicare Advantage was a thing, we only had the other option, and it's quite expensive, and it wasn't for everybody. So Medicare came out with Part C, or Medicare Advantage. This was meant to be a more cost-effective option to get coverage for Medicare through private insurance companies. So rather than having A and B be your first insurance, you choose a private insurance company to now be your insurance. Usually it's some form of managed care or an HMO or a PPO.
Okay.
It's going to be very similar to what most people are used to coming off of employer coverage or individual coverage.
Okay. So this is like where people who have A and B, the normal, or how would you phrase that? Just
Original Medicare.
Original Medicare. Okay. So they've got the red and white and blue card. If you're Medicare Advantage, then what you're probably getting something from the provider like Aetna, or I'm sure there's a few different insurance companies that are in that space that do that. Is that how that works?
Yeah. So when you join a Medicare Advantage plan, I think the easiest way to think about it is it almost replaces your Medicare cards. You actually end up leaving your Medicare card at home, and you show your Aetna card or your United Healthcare card or whatever company it ends up being.
Gotcha.
And they're responsible for all Part A, all Part B services. And then they'll usually include coverage for prescription drugs, which isn't included in Medicare. And then it will usually include things that aren't normally covered by Medicare, like dental, vision, hearing aids, stuff like that, that is still part of your health, but isn't covered by original Medicare.
Gotcha. And is there an extra cost to having the supplement plan, or Medicare Advantage, I should say?
It can be. In Southern California, we have a lot of people, so we have a lot of competition within the insurance companies. So most of the plans are little to no cost. They can have a small cost if you end up going with the PPO, but usually it's not any more than $100.
Interesting.
Yeah.
Okay. And so I guess I imagine behind the scenes what's happening there is the insurance company is negotiated a compensation for Medicare, and that's the circumvention there for that?
Yeah, without getting too far into the weeds on that, they are paid a monthly amount. So simplified terms, think that they get $1,000 a month. Instead of Medicare paying those claims for you, they're just paying the insurance company $1,000 a month to now provide you insurance, and in certain cases, contract with medical systems, build networks and facilities so that you can use those. So part of that money is also, however more efficient they are and a better job they do, they actually get more money on top of that to provide benefits that aren't covered by Medicare. So the dentals and the visions and the hearing aids. So that's why they're able to offer that. They get a little bit more money on top of what Medicare thinks they should get. So that way they can provide a full, one package.
One comprehensive package that somebody can have for their health care at minimal cost.
Yes.
Okay, perfect. So that's Plan A, B, and then the Advantage plan. Now, I've heard about Plan D, prescription, or I hear people talk about the donut or things like that. So give everybody a little because I think that becomes almost once you see A, B, and C, you start to wrap your head around it. You get the concept, and then you hear about Plan D and prescription, so expand on that.
Yeah, Part D, D for drugs is the simplest part of Part D. So it can be quite confusing, so I'll try to make this as simple as possible. But prescription drug plans, they come in two different ways. Either you can get it from your Medicare Advantage plan, those are called Medicare Advantage prescription drug plans, or MAPD, or you're going to get it from what we call a PDP, individual prescription drug plan.
Got it.
For the individual plan, you will pay a monthly amount. It can range from 50 cents a month all the way up to $170 a month, just depending on the prescriptions that you take at that time. So when you do turn 65 or come off employer coverage and you have to figure out which drug plan to go through, it can be really daunting because every drug plan, they have a different formulary or list of covered drugs. They can classify drugs in different categories, and they can price them in whatever way they kind of feel like. They have to go through a set rules of they have to cover at least 2 drugs in every category. They can't charge too much, but everything's going to be different. So that's where Part D can get confusing. That's where working with somebody like myself or any other type of agent to go through all of the plans in your area to make sure that your medications are covered and covered at the best rate.
Yeah, I'd imagine if you're somebody who is either in the business or has retired and they may be dating doctors and they may be on 5 or 6 or 7 different medications, planning ahead on Medicare really helps. Doing your homework when you're 64, not when you're 65, makes a lot of sense in this case.